My name is Carrie Farley, and I stand in firm affirmation of the following resolution. Resolve the United States federal government should establish a comprehensive single-payer national health insurance in the United States. Just to get over a definition really quick, single-payer healthcare system is, rather than multiple competing health insurance companies, a single public or quasi-public agency that takes responsibility for financing healthcare for all residents. That is, everyone has health insurance under one health insurance plan. Moving on, let's talk about inerrancy and let's talk about the status quo. The current healthcare system discourages people from seeking care that would make their quality of life better, according to Megan Lennart of CNBC in 2020. Over the past year, 22% of Americans say that they have steered clear of some sort of medical care, including doctor's visits, medications, vaccinations, annual exams, screening, vision checks, and routine blood work, because of the expense. Additionally, 15% report that another family member in their household decided to forego medical care because it was too expensive. 29% of Americans failed to take their medications as prescribed because of the cost, with about 19% of respondents saying that they did not fill prescriptions and 12% saying that they cut pills in half or skipped a dose. About half of Americans report taking at least one prescription drug, according to Kaiser. Unsurprisingly, the more prescriptions you have, the more each drug costs and the harder it becomes to afford. The very system of American healthcare is flawed, according to Mike Carberry of Advanced Medical Information in 2019, because of the fact that it discourages doctors from spending time with their patients. The United States spends $3 trillion on healthcare annually, representing $8,500 per person and nearly 18% of the total U.S. economy, while no other country swells above 12%. But its health outcomes are poor. There are no meaningful counterbalances to the power of insurance companies, big pharma, and increasingly the large corporate healthcare conglomerates that provide direct care. It would be absurd to try to increase the productivity of musicians by having them play faster. However, that is exactly what the American healthcare system asks doctors to do. Executives force an increase in the number of patients seen by physicians each day by establishing productivity targets that limit office visits to fixed time periods, such as 15 minutes to half an hour. Physicians can often achieve greater overall productivity by spending more time with fewer patients. For example, many patients with chronic kidney disease eventually need dialysis. Extensive research shows that patients have better outcomes, longer lives, and fewer complications when dialysis is started with a fistula, which requires a surgical procedure, or a graft rather than a catheter. However, because of the time, physicians typically start people on catheters in the United States, specifically because they don't want to spend as much time with their patients. The pandemic has also led to millions more people being uninsured, while citizens of other countries have enjoyed their healthcare safety net, according to Laura Santerham from PBS in 2020. Compared to people in most developed countries, including Canada, Americans for years have paid more for healthcare while staying sicker and dying sooner. In the United States, unlike most countries in the developed world, health insurance is often tied to whether or not you have a job. More than 160 million Americans relied on their employers for health insurance before COVID-19, while another 30 million Americans were without health insurance before the pandemic. The Urban Institute and Robert Wood Johnson Foundation suggested that as many as 25 million more Americans have become uninsured in recent months. That study suggested that millions of Americans will fall through the cracks and may fail to enroll for Medicaid, the nation's safety net and healthcare program, which covered 75 million people pre-pandemic. Now let's move into the harms. People literally die because they cannot afford to get healthcare. This is unacceptable in a world where almost every other industrialized country has single-payer healthcare system, according to Dr. Andrew Wolpar from Harvard University in 2009. The study published estimates nearly 45,000 annual deaths are associated with lack of health insurance. They found that uninsured working-age Americans have a 40% higher risk of death than their privately insured counterparts. They say, quote, that the uninsured have a higher risk of death compared to the privately insured, even after taking into account socioeconomics, health behaviors, and baseline health. We doctors have many new ways to prevent deaths from hypertension, diabetes, and heart disease, but only if patients can get into our office and afford their medications. The study found that 40% increased death rate among the uninsured. As expected, death rates were higher for males, current or former smokers, and people who said that their health was fair or poor. Additionally, the prioritization of profits over people has led to unnecessary addiction and death, according to Tim Harford from the Financial Times in 2014. The United States healthcare system costs about $13,000 a year more than Switzerland for a family of four, which itself is substantially more expensive than any other. The U.S. system costs twice as much per person as the universal health coverage provided by the U.S.'s NHS, or the U.K.'s NHS, and even the government-funded part of the United States covers more per capita. However, because U.S. doctors prescribe more treatments and those treatments cost more than they do elsewhere, most governments limit the price of treatments and the free-riding U.S. market to stimulate investment in medicine. However, American hospitals and drug companies have enormous leeway and raise prices, which leads to more people being prescribed opiates and more people becoming addicted. The solvency for this is a single-payer healthcare system. According to Dr. Dawn R. McCain for Physicians for a National Healthcare Program, a single-payer health insurance would resolve virtually all of the major problems facing America's healthcare system today. It would return the patient to free choice of physicians and hospitals, not just the choice of restrictive healthcare plans. It would relieve businesses of administrative hassles and the expenses of maintaining health benefits programs. It would remove healthcare equilibrium from the middleman, the insurance and care industry. It would also provide access to high-quality healthcare for everyone at an affordable price. the number of uninsured children and uninsured adults would decrease, and many billions of dollars could be returned to each patient for every year by eliminating the expenses of plan marketing, which is why we can confidently vote for Aff. Thank you.